in a flow chart, if you have to put in an image, the way you have to present your paper, all these will be explained when the live class goes. Okay. Now, coming to the express exam module, here each subject is covered in less than 20 hours. So because syllabus is covered in less than 20 hours, it gives students a comprehensive as well as effective coverage of the syllabus. It also gives students the answer writing skills. It also tells them how they need to include diagram, flowcharts, or any other thing that they can do in their paper in order to score effectively. All the educators are going to give them study plans. All these plans are going to enhance their exam preparation. Apart from this, there is also one-to-one doubt clearing sessions. So what is meant by one-to-one doubt clearing sessions? Here, a student-centric approach is taken. Every question, no matter how small, is valued and addressed by our educators to ensure a comprehensive understanding of the subject. So there is an instance when a student might have a doubt and may not ask the teacher in the class, thinking that his fellow students might judge him. No, but in this platform, we address exactly this. You can come to the educator and you can have one-to-one doubt clearing sessions where all your doubts, no matter how big or small, can be cleared. Personalized attention is given to the students so that they can benefit most from the session. And also there is a safe learning environment. Here, the students can ask and resolve the queries without the fear of judgment in a supportive and understanding settings. Now, coming to the hard copy notes, what do you understand by hard copy notes? Hard copy notes are designed in such a way that it gives in-depth coverage of the syllabus. A lot of flashcards, images, and lots of flowcharts are put in the hard copy notes, making sure that every point is covered. And it's done in such a way that it is easier for students to revise from. And it is also going to give the students a picture memory of the pages that are there. Okay. Next, we have the question bank. So how is the question bank designed? So basically, there are 3 levels, beginner to expert level. And the Q bank is customized in such a way that you can choose whichever topic you're studying from. And the questions that are covered in Q bank range from the prof exams, from NEET PG as well as FMG. So everything is taken care of. Next, coming to the practical sessions. So what do practical sessions have to offer? So usually there is a time gap between when practical sessions actually happen in your college and when you'll be giving exam. And in that time gap, whenever there's a time gap, you're going to forget a lot of things. So in order to combat that, we have designed practicals in such a way that every important topic is taken care of and you can watch it in less than 2 or 3 hours and go to the exam hall all prepared. Viva is also taken care. You're also given explanation about the various potters that could come. So this is going to help you excel in your practicals. Coming to the various subscription plans that are there, we have the foundation plan, advanced learning plan, complete learning plan, as well as ultimate MBBS plan. Coming to the foundation plan, it has various things like pre-recorded classes, live classes, express exam module, practical session, and the Q bank. So these are the 5 things that comes with the foundation pack. And coming to the others, the advanced learning plan, the same thing is going to be there for an extended period of 6 months. Coming to the complete learning plan, apart from all these 5 things that I mentioned, they're going to give you hard copy note set as well as one-to-one doubt clearing session. So these 2 are going to be the bonus. Coming to the ultimate MBBS plan, you have all these for a period of 4 years. That means through and through your MBBS, you're taken care of. Now you can use the code Dr Prashi Kaveri 20 for discount on the subscription. So this is a code that you can use for a discount for the subscription. Okay. Now coming to the topic per se, we'll be discussing about legal procedures, medical law, and ethics. So coming to these 2 chapters, we have certain long answers and certain short answers that we'll be discussing. And coming to the long answer, the first question is, what are the types of medical evidence? The procedure of recording of evidence in the court of law. Now, coming to medical evidence, what do you understand by medical evidence? Any statement which the court permits are all required to be made before it by the witness. That is, anything the witness comes and says. So for example, a doctor who's a witness comes and says anything in the court, no? All of it comes under medical evidence. Also, any documents that the witness comes and produces, that a doctor comes and produces, also comes under medical evidence. So any words said or documents produced. So what are the types of medical evidence? We have documentary evidence, we have oral evidence, as well as hearsay evidence. So coming to the documentary evidence, it deals with documentary evidence. So there are two types. There is primary evidence and secondary evidence under documentary evidence. So what is primary evidence? It is nothing but the document itself. So whatever document is being produced is a primary evidence. Come to secondary evidence, the certified copies made from the original. Any copies that are given or any copies that are compared with the original comes under secondary evidence. We have oral evidence that is direct in the sense evidence of a fact which is actually an issue, whereas coming to indirect or circumstantial, which is derived from the circumstances. So the direct one, as the word suggests, direct, no? So it's a direct evidence. Now coming to the indirect, that is, it is not a direct one. We try to derive it from the circumstances. So because we're deriving it, it is said as indirect. So it is a derived one. Now, coming to hearsay, that is any statement made by any person other than the witness. So, if any third person makes any sentence, it comes under hearsay. So, these are the different types of medical evidence. Now, coming to how do we have to record an evidence? Firstly, an oath is rendered. So, oath is number one. So, there are 5 things, okay, under record of evidence. So, when you write an answer in the exam, if you have enough time, first you write record of evidence. Then you write 1, 2, 3, 4, 5, and then you can write oath, you can write direct examination, you can write cross-examination, re-examination, and an examination by the judge. You can write all these 5, after which you can give one small para to each of this so that your answer will look more presentable. Got it? Coming to oath, that is, the witness takes oath in the witness box before giving evidence. So any person who is a witness has to give an oath. But if it is a child who is less than 12 years, need not give an oath because the court presumes that because the child is so small, it won't be telling any lies. Got it? So how does the oath go? It goes like this. I do swear in the name of the God that what I shall state shall be the truth, the whole truth, and nothing but the truth. So this is how an oath goes by. And then the oath is compulsory. And why is the oath taken? It is because it holds the witness responsible for the consequences of this evidence. So he is bound by law. There is something that is binding him and pressurizing him to tell truth. That is the ultimate motive behind rendering oath to a person. Got it? Coming to the second step, after oath, what happens? There is examination in chief, and this is also called as direct examination. It consists of questions put to him by the lawyer for the side which has summoned him. So the same party lawyer is going to ask some questions. So this is coming under direct examination. Then we have, in criminal trials, burden to prove is always on the prosecution and accused is presumed to be innocent until the contrary is proved against him. What they mean to say is that whenever direct examination is happening, the direct examination, the same party lawyer questions him. No? Here, until and unless whoever has been accused for any crime, maybe a robbery, maybe a murder, so any person who is accused for a crime will be thought as a innocent until or unless the court everything is charged against him, or until and unless the crime is proved for him. Okay, so until and unless he's going to be thought as an innocent. In government cases, the public prosecutor first examines the witness, because in government cases, the public prosecutor will be a prosecutor for the team that is being called. That is, for a victim, the public prosecutor will be the lawyer in cases of the government case. So he will be the one who will be doing the direct examination. Now, coming to what is the objective of direct examination, it is to elicit all the relevant medical facts and conclusions which the doctor has drawn from the facts. So you get to know about all the facts that are there and the conclusions that arise because of those facts. Examination is in the form of question and answer. Leading question are not asked. So what is leading question? Leading question is something that will suggest to the witness or whoever is there in the box about the answer desired. So leading questions are something in which the answer is just yes or no. So it is only going to suggest the answer to the person who is there in the box. Therefore, such questions are not permitted in the direct examination. Now, coming to cross-examination, the witness is a question by the lawyer for the opposite party. So the opposite party lawyer is going to question here. Competence and credibility of the witness is tested to elicit facts favorable to his case, to modify or explain what has been said, to develop new old facts to discredit the witness. So what do you understand by this? So whenever there is a cross-examination that is happening, the lawyer for the opposite side will be asking questions. And the questions can range from anything, okay? Maybe about the qualification of the person, about his social life, about a recent trip that he took to. So anything can be asked when it comes to cross-examination. And here it is done with the motive in order to get certain points to support whoever he is being speaking for. Also, in a lot of instances, what happens is that because the questions can be very rude and judgmental, it can discredit the witness also. Got it? The judge can always disallow irrelevant questions. If the judge feels that the question that has been asked is very irrelevant, he can always disallow them. Leading questions are permitted. So remember that yes or no type of question are permitted in case of cross-examination. So and cross-examination has no time limit. It can go up to days or weeks or even months. Okay. So what is the next step? We have re-examination. What do you understand by re-examination? The object is to correct any mistake or to clarify or add details to the statement witness made in cross-examination. So what happens? Cross-examination, as I told you, it is going to be very vast, very intensive. So during the time of cross-examination, sometimes the witness might make off certain remarks that need to be corrected, justified, and the lawyer for the same party feels like something isn't right after the cross-examination. That is when a re-examination is done in order to clarify such points. So the aim is to clarify. Got it? Questioning by judge. That is, the judge can ask question at any point of the examination in order to clarify or clear any of the doubts that might arise. Got it? So this is how you need to write answer to this question. Now coming to dying declaration, the procedure of recording it and how is it different from dying deposition. So coming to dying declaration, what is a dying declaration? It is a written or an oral statement. It can be a written, remember this, a written one or an oral statement of a person who is dying as a result of some unlawful act. If there is time, an executive magistrate has to be called to record the declaration. But if there is no time, the doctor can take it by himself. So what is important before taking a dying declaration? The doctor should say that the mental faculties of the person who is dying is intact, that he isn't compos mentee. What do you understand by compos mentee? Compos mentee says that the person, whoever is dying and whoever will be giving a dying declaration, his mental status are all right. That is indirectly saying that the doctor is saying or stating that the person is in a good mental status to give a dying declaration, and all that he's saying is not under the influence of anything, and he's going to say the correct things. This is meant by compos mentee. Now, if the condition is serious and there is no time, as I told you, the doctor only can take the dying declaration, but he has to take it in the presence of two witnesses. So two witnesses have to be there along with doctor when doctor takes the dying declaration. Oath is not admissible. Because why oath is not given? Because we believe that the person who is dying is going to tell truth and nothing but the truth. That is why oath is not necessary. Got it? Now, what is the procedure of recording? Statement is recorded in man's own words without any alteration in the terms. So whatever the man says, we have to record the same thing. Leading questions should not be asked. So what are leading questions? These are the yes or no type of questions which will directly direct the person towards answer. So such questions should not be asked in two places. Where are they? As we discussed, in direct examination should not ask yes or no questions, and even while taking dying declaration, you should not ask yes or no questions. There is no prompting or assistance. You're not going to help the person say anything. Sign or the thumb impression that the person makes, in case he is not able to talk well, he might make certain signs or impressions, and that can record it. You can write it in the person's language, and at the end of the recording, you have to take the person's thumb, or if you can, the sign on the document as well. Doctor and witness should also sign. So the person sign, doctor sign, witness sign is all necessary. What is the admissibility of a dying declaration? Declaration is admissible against accused and all other persons involved in the same incident which causes death. So if one dying declaration is given, it can be used against everybody who is involved in the crime. It doesn't have to give separate one for everybody. Okay, so everybody involved in the crime, the same dying declaration could be used. Dying declaration is accepted as evidence in case of death of victim in all civil and criminal cases where the cause of death is under inquiry. If the declarant survives, the declaration has corroborative value. So what is meant by corroborative value? Corroborative value in the sense, if the person who has given dying declaration, he's called as a declarant. Imagine he doesn't die, he survives. That means the dying declaration cannot be used directly in the court. This person, the survivor, has to go to the court in order to give a oral evidence. That is meant by corroborative value. That is, he doesn't hold its 100% actual value. Got it? Okay. Now, coming to the dying deposition. What do you understand by dying deposition? It is a statement of a person on oath recorded by the magistrate in the presence of accused or his lawyer who is allowed to cross-examine the witness. It is not followed in India. So this is what you understand by dying deposition. Because see, now coming to the differences between dying deposition and declaration. Okay, in deposition you can see that what is given. Now we'll write points for the dying deposition. These are the differences. Okay, number one, oath is given for dying deposition, and initially we said no, in dying declaration, when it comes to dying declaration, oath is not given. Now coming to the who records it, dying deposition is recorded by the magistrate, whereas coming to dying declaration, it can be recorded by an executive magistrate if there is time, or it can be recorded by the doctor himself in the presence of two witnesses. Okay, so the third point of difference, the person who is accused or his lawyer have to be there when a dying deposition is taken, whereas in case of dying declaration, they need not be there. It can be taken in the presence of doctor and two witnesses. Okay, and then cross-examination can occur in case of dying deposition. Cross-examination could occur because the lawyer is there, the opposite party lawyer is there, the opposite party accused is there, therefore they do cross-examination. Whereas in dying declaration, there is no scope for cross-examination because who is going to examine? The lawyer is not there. No, that's why. And what is the fifth and final simple difference? This dying declaration is not followed in India, whereas dying declaration occurs in India, happens in India. So these are the 5 differences that you have to write at the end of this question. Got it? Okay, now going to the shots. From this chapter, we have certain shots. Okay, so number 1, define inquest, define magistrate as well as police inquest. So how many types of inquests are there? I'll tell you. First, let's look into what is inquest. Okay, so inquest is nothing but inquiry or investigation into the cause of death. So what are we going to find out? We're going to find out the cause of death, conducted in cases of suicide, homicide, accidents, or suspicious death. That is nothing but inquest is nothing but the inquiry. No? So this inquiry, the main objective is to find out cause of death, and this you have to remember. What is the purpose of inquest? Tell me cause of death. And when all it is done in case of suicide, homicide, accidents, or suspicious deaths. These are the cases when we do an inquest. So there are different types, okay? We have police inquest, we have magistrates inquest, we also have coroner's inquest, and the medical practitioner's inquest. So in this question, they're asking us about the magistrate as well as police inquest. So coming to the police inquest, the officer in charge of the police station, usually the sub-inspector, but not below the rank of the head constable, conducts the inquest. So when we talk about police inquest, it can be conducted by anybody who is above the level of the head constable. Got it? He has to be above the level of head constable. And it is guarded by section 174 of CRPC. The police officer making the inquest is known as the investigating officer. So what is this officer called as? He's called as investigating officer. Now what happens? This police, he gets information that the crime has happened in so and so location. Now what he does after he gets to know about this, he gives intimation to the nearest executive magistrate. He is going to inform an executive magistrate, and he is going to proceed to the place where the body of the deceased is found. So he is going to go to that place by himself. After he goes there, he investigates the crime in the presence of two or more respectable persons. So two other respectable persons of the nearby locality have to be there. And what are those people called as? They are called as the panchas. What are they called as? Panchas. And then he prepares a report citing the cause of death, describing wound, fracture, bruises, or any other marks of injury found on the body. And the report that he has made is called as a panchnama. So the respected persons are called as panchas and the report is called as panchnama. So it is signed by the investigating officer and the panchas. So who are the three people signing? The two panchas that are there and the investigating officer. And in case of foul play, that is, if he suspects that it is a suspicious death, what does he do? The police officer sends the body for the post-mortem examination so that we get to know the cause of death. Got it? And after this, next question. Next part of the question, I mean to say, is a magistrate's inquest. What do you understand by magistrate's inquest? It is conducted by either the district magistrate, subdivisional magistrate, or any other executive magistrate. When it's done, it is done in cases of death in police custody while under police interrogation. So whenever there is a police investigation, interrogation, questioning happening, if somebody dies in police firing, somebody dies in prison, if it's a case of dowry death, death in a psychiatric hospital, or exhumation. So these are the 6 cases in which a magistrate's inquest is done. Only after the magistrate's letter you can do the inquest. And it comes under section 176 of CRPC. Got to know? Okay. Coming to the next question. What do you understand by hostile and expert witness? Expert witness who has been trained or has knowledge, experience, or education in technical or scientific subject and capable of drawing conclusions from the facts. So an expert, as the name suggests, he's an expert. So he has to have certain level of knowledge and skill or in a specific scientific subject, and he is able to tell his insights about what he's been observing. So who are those people? They are the doctors, firearm expert, fingerprint expert, as well as handwriting expert. All these because they have knowledge in certain scientific subject, they're called as expert witness. So what is the main objective? To point out professional facts. So if it's a doctor, he can say that what is the cause of death? Professional facts could be stated. He can give opinion such as that the findings are consistent with an alleged form of trauma. So as a doctor, if there is a trauma, if there is a wound, he can tell whether the wound is a bruise, whether the wound is an abrasion or a contusion or a laceration. All these can be said by the expert witness. Doctor cannot change his opinion while giving evidence, but can indicate other possibilities. That is, whenever he gives an opinion, if he feels that there is more to it, he can state all that, okay? But whatever he has told in the first place, he should not change it, okay? He has to be adherent, he has to stick on to it. But if there are any other possibilities, he can, give a hint about those possibilities. And all the conclusions at the end should be derived from facts only. It should all be factual. The expert witness can refer to the books to refresh his memory or to correct or confirm his opinion. The opinion of an expert can be proved false by the standard books. So standard books can be referred in the court even by the expert witness whenever they are giving their evidence. And the court can also use certain points that are there in the standard textbook to go against the expert witness. A doctor can be both a common and an expert witness. Common witness when he is just going and seeing whatever he has saying whatever he has seen. Expert witness whenever he gives his insight towards whatever he's seen. So the doctor can behave both as a common as well as an expert witness. Now coming to hostile witness. Who is a hostile witness? Person with some interest or motive for concealing part of the truth or giving completely false evidence. Hostile. What do you understand by the term hostile? Somebody who has been covering up or concealing the truth is called as hostile witness, or telling something which is false. He's giving a false evidence. Even then, it comes under a hostile witness. Now, what do you understand by conduct money? So conduct money is fee paid to the witness in the civil cases at the time of serving summons to meet the expenses of attending court. So whenever a witness is called to the court, in case of civil cases, the witness has to come to the court. He has to, maybe if he's working, he has to put a holiday. He has to travel a long distance to attend court. So the court, looking into all those matters, it gives certain amount of money to the person to as like a reimbursement for whatever he has spent. Okay, so that is called as a conduct money. In criminal cases, no fee is paid. Only in which cases fee is paid? In civil cases, a fee, the conduct money is going to be paid. However, conveyance charges and daily allowance can be claimed by doctor. So if it's a criminal case, by law, what happens? Conduct money is not given. But imagine a doctor coming to the court in order to give an evidence for a case of a criminal case. He would have put holiday, he would have traveled a long distance, plus he has to cover the charges of his food and everything. So all this daily allowance, whatever is required by him, could be charged from the court. Got it? So this is understood by conduct money. Now coming to euthanasia. What do you understand by the term euthanasia? Euthanasia refers to the practice of intentionally ending a person's life. By intention, that is, there is motive to end a person's life, then it is called as euthanasia. And why is euthanasia done? Why should we intentionally end somebody's life? We all have the right to live. So why does somebody's right to live be confiscated? It is to relieve the suffering, often in cases of terminal illness or severe pain. Maybe if the person is suffering from cancer, he's in such a painful condition, he knows that he doesn't have treatment, or he knows that he cannot live any further. He feels like, why should I live for some more years in such pain? That is when a euthanasia could be asked for. So what are the types? We have voluntary euthanasia, that is done with the patient's consent. We also have involuntary euthanasia without the patient's consent. So these are the two types, voluntary euthanasia and involuntary euthanasia. Now coming to what is the legal status of euthanasia. Some places permit it under strict regulation, but in so many countries, euthanasia is prohibited. Coming to the ethical considerations, euthanasia raises significant ethical question. As I told you, there is something called as right to live. Every person in a country, irrespective of whoever, has a right to live. So the ethical consideration is regarding this person's right to live. It brings in debates about the patient's autonomy, the sanctity of life, and the role of medical professions in ending life. So according to the ethics, I believe that every person has right to live, and the doctor, in whatever senses, could do something for the person to live. Therefore, ethical considerations could arise. Got it? Now, what do you understand by the term professional negligence? What are the differences between criminal and civil negligence? Describe the legal principle of res ipsa loquitur. Precautions should be taken to prevent the professional negligence. So this is one more 10-marker question that is important and come in your exam. So what do you understand by the term professional negligence? That is, absence of the reasonable care and skill or the willful negligence of a medical practitioner in treatment of a patient which causes his bodily injury or death. That is to say that the doctor, whoever is been treating the patient, isn't skilled enough. He doesn't have proper skill in order to protect the life of the person. Or he might have neglected, he might have done some work which, because of his negligence, has put the patient into danger. So, and that work, that act could have caused injury or death to the person. So this is the meaning of professional negligence. Got it? Now, what do you understand by civil negligence? A patient, or in case of death, relative, for getting compensation from the doctor. So when is civil negligence applicable? That means the person has already died, okay? And now the relatives feel that there's a foul play and then they want compensation. This is when a civil negligence can be claimed. A civil negligence can be claimed by the doctor as well. So the patient or his, in case if the patient has been dead, his relatives can claim, number one. Number two, the doctor can claim. When does the doctor be able to claim? That is for obtaining his fees for the patients or relatives. So when he has not obtained his fees, then the doctor can claim a civil negligence stating that he has not got his fees. Now, coming to the elements of negligence. What are the elements of negligence? This is the duty of the doctor. That is, what is the duty of the doctor? That is, he has to be skilled and competent enough in order to save the life of the person. That is meant by the duty of the doctor. Dereliction, failure on the part of the doctor to maintain applicable standards of care and skill. That is dereliction. He has failed to maintain standards of care, and because he has failed to maintain standards of care, that is why the injury has occurred. Direct causation, connection between negligent act and the resulting injury. That is, you have to prove that only because that particular act happened, there is injury, and if this act had not taken place, there wouldn't be any injury. Damage, type that causes the foreseeable by a reasonable physician. That is, any physician who is reasonable with basic competence and skill could have judged that such and such injury could have happened because of the act. And if the doctor fails to understand it, only then damage is occurring. So these are the four elements that has to be proved whenever a professional negligence or criminal negligence can be sought for. So what are the four elements? The doctor's duty, dereliction from his duty, the direct causation between the act and the injury, and the damage which was not foreseeable. Got it? Then coming to the burden of the proof. The burden of the proof lies on the patient. That is, patient cannot sue a doctor if no damage has occurred. That is, the damage has to be there for the person to sue the doctor. Loss which can be measured and compensated in terms of money. So there should be some loss. For example, the loss could be damage to a part of the person, or damage in such a way, injury in such a way that he couldn't attend his job. There was loss of money because of it, or his travel was impaired. So all this, there is loss to the person in some form or the other. Liability. What is meant by liability? It is the amount of damage done as a measure of extent of liability. Example, what comes under liability? That what is the doctor charged for it? How much he has to be paying in case the burden of the proof from the patient is got. That is the medical expenses, including medical rehabilitation, transportation, additional surgical procedure. So the patient might charge the doctor for all these. He might feel that all this additional cost was because the doctor professionally neglected him, and all these things, the medical expense, rehabilitation expenses, transportation, surgical procedure cost, all these could be sought for. If the person, apart from these proper medical things, he can also seek money for the loss of earning. He might say that I've been admitted in the hospital or in bed rest because of all these procedures, and without this procedure this couldn't have happened. In such case, loss of earnings can be charged, and he can also charge compensation for pain and suffering that he endured because of all these extra things. Got it? Now, what are the instances for medical negligence? The instances are refusal to admit the patient requiring urgent hospitalization. Imagine if somebody was very hypoglycemic because of loss of insulin. Maybe he suddenly, because of certain cases like infection or pregnancy, the type 1 diabetes could have precipitated, and the doctor knows that if he doesn't admit that patient, the person might die. Even then, if the doctor doesn't admit, this refusal to admit, that is one of the instances for medical negligence. Failure to obtain informed consent. So for any surgery or for any procedure, it is important to take a consent. If the doctor fails to take consent, he can be charged under medical negligence. Failure to examine the patient. That is, if the patient has come with fracture, imagine the doctor doesn't do certain mobility tests in order to find out if the mobility is impaired or not, or which leg is fractured. In such cases, failure to perform sensitivity testing. For example, whenever you give even a small dose of lignocaine, a sensitivity test is very important, because if the person, very few people will be sensitive, but in case that person in whom you inject lignocaine is sensitive, he might even crash and die. That's why doing a sensitivity testing is a need of the hour. Not ordering X-ray for a fracture. If the person comes with immobility of limb, he comes limping with, if he has a fracture of the femur, he comes limping, he won't be able to walk, he's in so much pain. And even then, if the doctor fails to do an X-ray, he could be charged under medical negligence. Not reading an X-ray correctly. That is, there might be a small airline crack in the X-ray, and reading X-ray is the basic, okay, that every medico after they finish MBBS and internship should be able to do. If the person fails to read the X-ray, even then he can be charged under medical negligence. Now, what are the other things? Delay in diagnosis, that is simply doing unnecessary tests, not coming to a diagnosis at a reasonable time. See, it isn't necessary that every doctor has to perfectly do everything in the first day, okay? Like, for example, first day he has to identify what is wrong. It is not like that. But there should be a reasonable time by which a diagnosis is made. Or in case, imagine he's admitted for 2 days or 3 days, even then, if he cannot make a diagnosis, he has to at least refer him to a doctor who has more experience in order to make the diagnosis. But instead, let's say the doctor doesn't even refer and keeps him and just doing so many tests in order to find out by himself, not going anywhere, it comes under medical negligence. Making wrong diagnosis comes under medical negligence. Imagine he doesn't know what shit is happening. He has to refer him so that other experienced doctor might make a diagnosis. If wrong diagnosis is made, wrong treatment is given and put the patient's life into risk. Okay, that's why. Failure to provide substitute during absence. If they are not there, they have to call some other doctor as an attending doctor in order to take care of the patients that are admitted in the nursing home or the clinic. Failure to warn the patient of side effects. For any drugs or any procedure, the side effects has to be informed to the patient. Experimenting on patient without consent is wrong. You cannot give any unnecessary drugs to the patient. You have to inform them, take the consent, only then do all these. Giving overdose of medication. If you give overdose of medicine and if the person has side effects, you can be charged. Failure to give proper instructions, like for example, which tablet has to be taken before food, what has to be taken after food, how much quantity has to be taken, what food items a person has to take after surgery. All these instructions should be given by the doctor. So failure to give all these instructions could also come under medical negligence. A doctor is not liable for negligence whenever there is an error of judgment. If he secured all the necessary data, that is, imagine under his power, whatever he could be able to do, whatever investigations he could do, whatever tests he could do, whatever treatment he has to do, everything. Like for example, for a doctor of the same degree and level of competence, he's done everything right from his end, then the doctor is not liable. Also, failure to cure or for the bad results if he has exercised reasonable care and skill. That's what I told you. No? He has to be competent enough. It's not like he has to. Every doctor has to be the best, okay? But to a reasonable level, they have to know everything, and to a reasonable level, they need to know that when they have to refer a particular person to a doctor with better experience so that his life is saved. So the patient's life or the patient's treatment has to be the essence of the treatment. Okay. So if the doctor does everything under his power, then he cannot be charged. Now, coming to criminal negligence, what is criminal negligence? It occurs when the doctor shows gross absence of skill. Criminal, what does criminal indicate? That is almost death. So when the criminal negligence can be charged, that means the doctor he doesn't have any skills only, then criminal negligence can be charged. Doctor performs an illegal act, or the act involves extreme departure from the ordinary standard of care. That is, there is a set of instructions that have to be followed in treating a person, or if the doctor completely forgets this, leaves this under something else, then a criminal negligence can be framed, practically limited to cases in which the patient has died. So criminal act which results in death, that is when a criminal negligence can be charged. Example, amputation of a wrong finger or limb, leaving instruments in the abdomen after surgery, a cotton or scissor is left in the abdomen, performing criminal abortion. That is, for example, after they do an abortion without the mother's consent, gross mismanagement of delivery of women. So there could be PPH and the women could die. What is PPH? Postpartum hemorrhage. That is after delivery of the baby, torrential hemorrhage, because of which the lady might go into shock and die. So these are the things which cause death of the person, which puts the life of the person in a lot of risk. So in such places, a criminal negligence can be charged. What is the doctrine of res ipsa loquitur? What do you understand by res ipsa loquitur? The patient need not prove negligence in case where the rule of res ipsa loquitur applies. So what do you understand by res ipsa loquitur? We saw, no, whenever a medical negligence has happened, it is a patient who has to prove that a negligence has happened. Now suddenly we are studying that the patient need not prove. So in which instance he need not prove? That is when the thing with the fact speaks for itself. You look into the incident and you know what has happened. In such cases, res ipsa loquitur, it is called as. What are the conditions to be satisfied? In the absence of negligence, the injury would not have occurred normally. So imagine a surgery has happened and the doctor did surgery on a wrong limb. For example, there's a fracture in the right limb and he did something on the left limb. And now the person's right limb, because it's fracture, it's gone. And the surgery on the other limb, because of which he cannot walk. And when you see this, you can say that the doctor has made a gross mistake. In such cases, res ipsa loquitur occurs. Doctor had executive control over the injury-producing instrument or treatment. Imagine the person, the doctor, if he's using a coagulating machine, he's using the machine to coagulate, and he goes to such an extent, after he coagulates, after there's no bleeding, he has to stop. Imagine he goes to such an extent where the surrounding tissue is all damaged. So you know that the doctor had control of the instrument and he did not do what was necessary to stop it from working. And if that caused problem, even then res ipsa loquitur works. Patient was not guilty of a contributor negligence. So what is contributor negligence? This is the negligence from the patient's side, which adds to the negligence of the doctor, and together all these becomes the entire negligence. But in case the patient didn't do anything, there was no contributor negligence, then the res ipsa loquitur works. That is, only the doctor's fault was causing damage. What are the examples? Prescribing an overdose medicine, giving a overdose medicine, failure to give antitetanus serum in case of injury by tetanus. So what is tetanus? There is lockjaw, there is opisthotonus, pleurotonus, there is exaggerated backward bend, emprosthotonus, exaggerated forward bend, exaggerated lateral bend. So all this happens in tetanus. No? So whenever a case of injury comes to you, you have to give a tetanus shot. If the doctor fails to do it, or a blood transfusion misadventure, that is, a patient is A positive and you give him A negative blood. In such gross mistakes, the mistake speaks for itself, where the law of res ipsa loquitur works. Got it? Now, coming to informed consent. What do you mean by informed consent? What is consent, first of all? Consent is a voluntary agreement or the permission which is legally valid given after understanding what it is given for and the risks involved. That is, consent means stating yes, stating his consent for something after he has understood the entire implications of whatever he's giving consent for, and it is also legally valid. The permission is legally valid, then it is called as consent. Got it? Now, coming to the informed consent. What is informed consent? That is, the patient, whoever is giving consent, has to understand certain things. What all he has to understand? He has to understand the nature of the condition. He has to understand the nature of the proposed treatment or procedure, expectations of the treatment and likelihood of success. That is, after treatment, how much proportion of success, whether it is a 50-50 success rate or 100% success rate, 99%, the patient has to understand it. What are the alternative approaches for treatment? For example, if there is a hysterectomy for a fibroid, what are the alternative treatments that could be there? Myomectomy could be there. You can do medical management. Gonadotropin-releasing hormone antagonist could be tried. So the patient has to understand all these alternative approaches that are there. He has to understand the potential risk of not having the treatment and also the chances of success or failure. So basically, through and through, A to Z of surgery or a procedure has to be explained to the patient, including the risks involved. And then if the consent is taken, the patient is informed of everything. Therefore, is called as informed consent. Now, vicarious liability. What do you understand by vicarious liability? Employer is responsible not for his own negligence, but also for the negligence of his employees. In such act, it is called of employment within its scope by the principle of respondent superior. Vicarious liability means the employer, that is the person who has employed the employees. So employer is a great one. Okay. So this employer is responsible for the mistakes of the employees also. So this employer is a superior one. So he has to answer to the problems that are being made by the employees also. So the master, the employer, has to answer for the problems done by his employees, which is called as vicarious liability. Now, what are the examples of such vicarious liability? The principal doctor responsible for the negligence of the assistant. When two doctors practice as partners, they are responsible for the mistakes of each other. When two or more independent doctors are attending on a patient, even then they're responsible for the mistakes of each other. Borrowed servant doctrine. That means if a doctor for the surgery, if he has borrowed some other assisting doctors, then the mistakes of the assistant doctors also comes under the main doctor who has borrowed those doctors. A hospital as an employer is responsible for the negligence of its employees for acting under its supervision and control. So the hospital, the entire body, is responsible for the mistake of the doctors that are employed. Hospital management is responsible for the mistakes of resident doctors and the interns, all the PGs, interns. If they do any mistake, no, the hospital management is responsible. If the physician has written prescriptions properly, then he is not responsible if the pharmacist has not understood and given some other wrong medicine. Therefore, it is important for all the doctors to see to it that the prescription that they are giving has to be legible. Got it? If their prescription is legible, they're not guilty of the mistake of the pharmacist. When the doctor recommends another doctor to his patient, not liable for the negligence of the new doctor, because he has referred the patient to somebody else. He's recommended, and the patient by his choice went to that recommended doctor. So if the recommended doctor does any mistake, the actual doctor is not responsible for that mistake. Got it? Now, what do you understand by infamous conduct? infamous conduct, you have medical malpractice. What is medical malpractice? Instances where the doctor failed to provide the standard care leading to harm or injury can result in lawsuits and loss of medical license. So the doctor doesn't give proper care. The doctor doesn't give a standardized care. That is meant by medical malpractice. Because standardized care is not given, there is some problem that is happening, that it is called as medical malpractice. Fraudulent practice. Some doctors engaged in the fraudulent activities such as falsifying the patient records, overbilling the insurance, or performing unnecessary procedures for profit. So these are all the practices that are done in order to get the extra profit by the doctors, okay? Like whenever there is an insurance that the doctor or the patient can claim, the doctor overbills in order to get more money from the company, or he gives false records, or he gives false certificates. All these are unlawful. These come under infamous conduct. So what are the other things that come under infamous conduct? If there is any abuse of patients, cases of sexual misconduct, emotional abuse, or exploitation of the vulnerable patients have led to severe legal and professional consequences for the offending physicians. So anything that is unlawful, for example, sexual misconduct, emotional abuse, exploitation of vulnerable patients, everything comes under, what does it comes under? It comes under abuse of patients, and it comes under misconduct. Substance abuse. So when we talk about substance abuse, physicians struggling with addiction may endanger the patient's safety, leading to the infamous conduct such as prescribing medications irresponsibly to the impaired patient. So if a doctor has been into drug addiction, or if there's this movie, no, the Telugu movie Arjun Reddy, you know the movie, right? There later his license would be withheld for some time. He won't be able to practice. He will be barred from practicing for 2 years. Why? Because that person, when he was intoxicated after being taken a lot of alcoholic drink, he goes and operates on a patient. So in such cases of substance abuse, then also this misconduct could occur. A violation of ethical standards, engaging in research misconduct, falsifying data, or not obtaining informed consent undermines trust in the medical profession and can lead to significant fallout. So these are the various instances where we can see that infamous conduct has occurred. Got it? Now we will discuss about certain MCQs that are there. Okay, these MCQs are very important, and we will look into these MCQs. Okay, so coming to the MCQs, coming to the first question, what is the first question? Which of the following is a requirement for the dying declaration to be admissible in court? So it's a single choice question, and the answers are: the declaration must be made in writing, the declarant must be mentally competent at the time of making statement, the statement must be made within 24 hours of incident, the declaration must involve at least 2 witnesses. So what is correct about dying declaration? We studied, no? What is correct? The declarant must be mentally competent at the time of giving the evidence. Got it? So that is the correct answer. Correct answer is B. That is, he has to be in a state of composed mentality. The doctor should certify that he is in a proper mental state whenever he is giving a statement. Now coming to the second question, what is the primary purpose of a police inquest? The options are: to determine criminal guilt, to investigate the cause of death in suspicious circumstances, to gather evidence for civil lawsuits, and to evaluate police conduct. So what is the answer for police inquest? The answer is the option number B, that is to investigate the cause of death in suspicious circumstances. As I told you, whenever we're discussing about inquest, whether it is a police inquest or a magistrate's inquest, the ultimate aim of both of these inquests is to obtain the cause of death. Therefore, that is the answer. Okay. Now coming to the third question, in which circumstance is a magistrate's inquest typically held? Deaths from natural causes, deaths involving known medical condition, suspicious unexplained violent deaths involving dowry, deaths occurring in hospital. What is the answer? The answer is clearly C, suspicious unexplained and violent deaths during dowry. Why? Because I told you magistrate's inquest is done only in very few cases. That is, death occurring because of police interrogation, death occurring due to police fire, death occurring in a psychiatrist, not any hospital, in a psychiatric hospital, death occurring because of dowry, exhumation. So these are the cases when a magistrate's inquest is done. In all the cases, police inquest will be done. What does the term res ipsa loquitur translate to? We discussed right now, no? What does it translate to? What are the options given? The thing speaks for itself. The facts are in dispute. The evidence is inconclusive. The burden of proof is on the defendant. So what is the answer? As I told you, res ipsa loquitur is when you see the crime or when you see the incident, you can say what has happened. That is, the thing speaks for itself. Therefore, option A is the correct answer. Coming to the next question, which of the following is a requirement for establishing res ipsa loquitur? Let's see the options. The plaintiff must prove negligence beyond a reasonable doubt. That means whoever the patient has to prove something. The accident must be of a type that does not usually occur without negligence. The defendant must have admitted fault. The plaintiff must have eyewitness testimony. So what is the answer? So basically, what is res ipsa loquitur? That is, the fact proves for itself. If you see something that has, by looking at the incidents only, you're able to say what has happened. That is meant by res ipsa loquitur. Here, the essence is that, as we discussed in the question also now, whenever accident has happened or this particular activity, the particular instance has happened only because there was negligence. That is, there is a direct correlation between negligence and the incident. Then only a res ipsa loquitur can be proved. Therefore, option B is the right answer. Now, coming to the last question, what is vicarious liability? Let's see the options. Liability for one's own actions, liability imposed on employer for the action of employee, liability that cannot be assigned, liability for third-party actions only. What do you understand by vicarious liability? As I told you, it is nothing but it speaks as a respondent superior. That is, the employer who has employed the employees, who's taken the employees, will be responsible for the mistake or for the actions of employees also. Therefore, what is the correct answer? Option B is the correct answer. Liability imposed on an employer for the action of employees. Got it? So this is the end of the topic. I hope you enjoyed this session. Thank you.